Dear ladies and gentlemen, it is a great pleasure to be selected for such a great event and present you the last updates in the world of the acute cystitis symptom score, this time in multinational settings. Our aim was to evaluate the psychometric and diagnostic properties of the ACSS based on the data from studies that have used the ACSS starting from 2011. The ACSS was developed as a self-reporting questionnaire for the clinical diagnosis of acute cystitis based on complaints. It combines graded assessment of the severity of symptoms and their effect on the quality of life. The ACSS is consisted of two parts, diagnostic and follow-up forms. Both parts include 4 identical domains containing 6 items for typical symptoms of acute cystitis, 4 items for differential diagnosis, 3 items for the quality of life, and 5 items for additional conditions. Part B, as an addition, contains one more domain called Dynamics, directed to monitor changes in the conditions of the patients. Today, our database contains the anonymized medical data of more than 2,000 women from the different countries. For current presentation, we have extracted the data from 1593 cases with non-missing questionnaire data. Here you can see the very basic demographic information about these respondents. In this table, the basic psychometric characteristics of the different domains of the ACSS are presented. As you can see, all the specific domains of the ACSS are very good balanced and correlated. Since the typical domain of the ACSS was the most important for the symptom-based diagnosis, I decided to present you the ROC curves for it. As you can see on this graph and the table below, 3 leading symptoms cover a wide area under the curve, but the total score of this typical domain covers the largest area. Therefore, using the ACSS, we should focus on the summary score rather than on individual symptoms. The best discriminative ability of the ACSS by the summary score of the typical domain by 6 was revealed using statistical calculations at the earliest stages of the pilot studies. The following graph obviously demonstrates this property. See, starting with a total score of 6, the number of respondents who do not have acute cystitis drops dramatically and further decreases steadily. Since we have collected a lot of different worldwide data, we decided to compare the diagnostic abilities of the ACSS with the diagnostic values of different lab investigations. These two graphs clearly demonstrate that the ACSS-based symptomatic diagnosis of the acute cystitis is more reliable than the results of the lab investigations. This table contains the results of some other diagnostic values of different tests. As you can see, the highest and the most optimal values, again, belong to the cutoff by the ACSS, followed by urine microscopy and dipstick urine test. As for diagnostics odds ratio, the highest ratio, expectedly, belongs to the ACSS again, as you can see on this forest plot. And difference between it and the odds ratios of other diagnostic tests is statistically significant. The prognostic relationship between domains and the diagnosis is not exactly linear, although it is positive and quite strong. This suggests that the symptom-based diagnosis with the ACSS can be made even more accurate using different mathematical models. Going further, I can say that today we have an opportunity to develop an ACSS-based diagnostic application which will be capable of diagnosing acute cystitis in women with an accuracy of close to 100%. On this last slide, you can see a brief summary of all that was spoken about above. I cordially thank all our colleagues who have participated in the previous ACSS studies. And of course, I thank you for your attention.